Hi guys. Welcome back to Nursing and Therapy by Adobe Okoye. And for those that don't know me, my name is Adobe Okoye and I'm a nurse. And this is my channel, Nursing and Therapy. We're here to talk about several aspects, majorly nursing and therapy, and life, health, nursing, therapy. So, if you're here for the first time, welcome and relax and listen to what I have to say, look at my previous videos, and get ready to share with your friends as well. And I believe you're going to learn something, or because you always learn something from my channel. It's been a long time here because I've been doing other things, of course. And what actually brought me today is something very common, but very important, or let me say, very common and important. It's something we're very familiar with, and it's bad breath or mouth odor. It's also called halitosis. Okay, so I normally make my videos very brief, and it's just like an awareness. So I'll always say this channel is to create awareness, give you some information about some things, and then it makes you to like you just need to go ahead or go as far as browsing more, doing more research, calling your own doctor to get more information regarding some what I just whatever I have or whatever I say to you. Okay, so today is about halitosis, bad breath. Have you ever been in a room or maybe with someone and then they talk or they speak, and then the smell or the odor that comes out from their mouth takes over the whole atmosphere? That is halitosis. It's called mouth odor. This is to note that, like, when you have something to eat or when you eat something, like the tongue has some enzymes that breaks down whatever you eat. It's normal to, perceive something, but not after you've drank water or after you've brushed and then you're still getting the same problems. It shows that something is wrong and you definitely need to find out what is wrong. So I always have my my topic scripted down just to explain better or briefly and to give me like the details of whatever I have to say. So, like I said, today is about halitosis. It's an oral health problem that is very common, like I said earlier. So there are several causes of this bad breath or mouth odor. And we look at first poor oral hygiene. Yeah. So I want to make it known that a lot of people now will do so many things to their body or have this lifestyle of skincare and stuff like that. So I want to let people know that as far as or as much as you are taking care of your skin, your face because you want to look good, you should also take care of your mouth, oral hygiene. Make it a lifestyle. Make it a routine that when you wake up in the morning, you brush your teeth, you floss. After before you go to bed as well, you do the same. It's good to actually brush at least, they say, at least twice a day. That's morning and night. And night is maybe after when you've had everything you're supposed to eat that day and you're now going to bed. All those things you've eaten, just brush it off. So people have poor hygiene. They don't maintain that lifestyle, that routine of taking care of their teeth. And the truth is that if you don't brush and floss daily, food particles will remain in your mouth, causing you bad breath. The colorless, sticky film of bacteria that forms in your teeth. So that is easy. It's actually easy to brush off. Now, this is researched. Yeah, it's actually easy to brush off because if you don't brush it off, it brings or causes bacteria that then causes you to have mouth odor or bad breath. And it's also important to know that if you're using dentures, try to keep it clean. Keep it like wash it the way you should. And I know that people that use braces, it's very difficult for them, but I think, I'm not so sure, but I think that before or after they get the braces, they teach them how to brush using the braces. But if you use braces and maybe you don't know about it, you can ask. Like I said, I don't wear braces, I'm not sure about it, but they teach you how to take care of it and how to keep your mouth clean while wearing it. So poor dental hygiene or poor oral hygiene can cause mouth odor. When you eat, the food breaks down and then it leaves it causes like breaks down and causes some bacteria in your mouth, which is normal. Yeah, it's normal because like I said, the mouth has some things like enzymes on the that helps to break down food. It's normal. So, but what you're supposed to do is after eating and eating everything that you want to eat, brush your mouth, keep your mouth clean. Some spices or some foods like onion, garlic, when you have them or when you eat them, ensure that you brush. Yeah, because they have this strong smell as well. Then people that smoke tobacco products, one, they make your mouth to be dry, and then they should know that smoking is bad, but then while you're trying to stop smoking, try and maintain this good oral hygiene to help you. So when you're communicating with someone, the person who am I perceiving? For people that don't know how to hide it. The other thing is, when it comes to tobacco, there's this one that people, should they say eat, they put in their mouth or in their teeth, and then it stains their teeth and then also causes this odor as well. I also want to let you know that when we talk about mouth odor, it's not just about what you eat. When we talk about mouth hygiene or oral hygiene, it deals with your mouth generally, which includes your teeth, your gum, your tongue. Everything in there, it deals with it. So as you're caring for your teeth, you also know that you're caring for your tongue. Because I know that some people, I've had someone said to me, "Oh, I only brush my teeth," and you don't brush your tongue. The tongue also has its own bacteria that you need to brush out. Then I said that it has to be like a lifestyle. Let it be a routine for you. Do it every day, and you will notice that you get better. A lot of us don't know about this. It's only when you're keen to know, when you're very careful about yourself. It's not about insecurities now. Like when you're very conscious about, your appearance and towards others or what you do, that's when you get to browse about things like this and get your information regarding this. Okay, so like cause of mouth odor or bad breath, we have gum disease, that's gingivitis. Sometimes people that visited their dentist, you go to the dentist and they're like, "Oh, you have a diagnosis, chronic marginal gingivitis or marginal gingivitis." So it's a problem that has to do with the gum, that is the using medical terms, the inflammation. And okay, so let me just break it down. It's when you have your gum swollen, red, maybe bleeding, and then painful as well. So that's gingivitis. This thing is caused by poor oral hygiene, and it develops over time. So apparently you've not been taking care of your teeth, and then maybe you now develop like a tooth problems or something, and then your gum becomes inflamed. So it has it here that I'll just read it out for you to see what I have here. Gingivitis is an inflammation of your gums that can cause redness, swelling, and bleeding. Yeah, it's caused by plaque. So that plaque that I told you that it's a sticky film that builds up on your teeth, which can be removed by simple brushing and flossing. So gingivitis is caused by plaque. Then it has here that untreated gingivitis can lead to periodontitis. Now, this periodontitis damages your gum tissue and lead to tooth and bone loss around your teeth. I think it's this periodontitis that causes this what do you call it again? Tartar. Those, should I say it's yellowish in color, that it's like debris or kind of solid, that if you've seen all these dental videos, they have a way to bring it out. They just kind of pluck it out from the teeth. It's around your teeth and your gum. So I don't know if you've gotten it now. So this gum disease is caused by, it's caused by plaque, not plague. That's the correct pronunciation. It's caused by plaque, which is a sticky film that builds up around your teeth and then causes you periodontitis. That's that tartar buildup. Yeah, and it says here that there is like a pocket around your gum, pocket fillings or something around your gum, which brings up this gingivitis. That it shows that you have a problem with your teeth, and then you need to seek the help of a dentist to be able to deal with this. Okay, so I have the fourth one. I think I've mentioned three now: poor oral hygiene, and I said food, the causes of bad breath, poor oral hygiene, food, tobacco, and then this gingivitis. That's this gum disease we're talking about. So there's this one I have to say again, which is very common. I don't know if people or a lot of you have heard about tonsil stones. So what are tonsil stones? Tonsil stones are, sometimes if you browse it, you would see it as well. When you brush and then you have this sort of small yellow, I call it like solid, come out. I don't know if you've seen it, but if you see that kind of thing, it's called the tonsil stones, and it's when food particles or debris of food particles you've had goes in around your tonsils and have like pockets in there. So when you are seeing it all the time, it shows that you have problems with your oral hygiene. And if you by chance brought up that stone and maybe pop it, it smells. It's very nasty. The smell is, I don't know the word to use, but it's horrible. So imagine having that in your mouth, and when you're not bringing it up, like when it's just stuck in your mouth and then you speak to someone, obviously, you don't even, your mouth will smell. Yeah, so you won't expect less, your mouth will smell. So tonsil stones, they cause mouth odor because they collect bacteria, and then store in your mouth when you don't brush, or when you're not like aware of your oral hygiene. It now causes you mouth odor, halitosis. Okay, so it also says that some medications can cause mouth odor as well, and when you have infections in your mouth. But when it comes to these medications, I want to believe that your healthcare provider, if they're going to give you, or they're giving you any medication, they would let you know about the side effects. And or even if they don't let you know, if you're watching this video, you can ask them, so what are the side effects of this medication? You can also, yeah, just ask them, and then they'll let you know. So at least you have it in mind that I'm supposed to expect this, and you find a way to actually deal with it. And some infections, if you have like infections in your mouth, like let's say you have a surgery, some surgical wounds after some surgery, after like a mouth surgery, it could cause mouth odor, but that one is like temporary. It's something that you would handle while waiting for your wound to heal. Of course, maybe as a result of surgical wounds, I mean, is you had a tooth removal, or anything at all, and it could cause mouth odor, but it, like I said, is temporary. So they said there's so many other causes, according to research. There's so many other causes. If you have a respiratory infections, if you have bronchitis, if you have diabetes, sinusitis, all these things can cause mouth odor. Then liver or kidney disease, that's GERD. If you have GERD, it could cause mouth odor. It's something that you should browse or search about. Ask if you already have any of these mentioned. It could predispose you. You can speak to your health personnel, your doctor who is taking care of you, and then they will guide you more on what to do. All right. Okay. So now I have here, what does it mean if you have bad breath all the time? So like I said, it's normal to eat something and then expect to have like not your fresh breath, okay? But then the concern is, when you eat something, if you don't have any mouth problems, if you don't have any health problems, when you eat something and expect to have that breath, and you don't, when you eat something and you don't take care of your mouth, there is no oral hygiene. That's where the problem is. Now, if you eat something and you brush, take care of your mouth, you are fine, you are good. But then If you eat something or when you eat something and still after brushing or after your normal routine, your oral routine, and you discover that your breath is still not fresh, there could be something. It's actually leading you to, knowing that there is something wrong. There is something wrong. So what are you going to do in that case? In that case, you ask yourself, do I have any dental problems? Visit your dentist. Go for the dental checkup. And then when they assess you, when they look in your mouth, they're able to see, okay, you have one or two things, and then you begin treatment. Or it could mean that you have some diseases or some disease that is leading to this or that's affecting this. I don't know if you get what I mean. Like, I'll say it again. When you eat something and you carry out your normal routine, then it shows that, like, when you eat something and carry out your normal routine, you're supposed to be all right. But then if you're not all right, you still get that odor. Visit your dentist and see if there's a problem in your mouth, because they will look and then see if there's something they need to start treating. Treatment will begin. Or it shows that it could mean that you have something, a disease that needs to be treated or that is causing, not like to be treated, that is being managed, that is causing the mouth odor. Like I said, some respiratory problems, bronchitis, sinusitis, GERD, that is causing this. So the point here is that you need to know. Knowledge is power. You need to know what the problem is. I'm saying two things here. One, do what you're supposed to do, which is having a great oral hygiene, like making it a lifestyle. Do what you're supposed to do. Then, if you're doing what you're supposed to do and it's not working, find out why. Find out why. Finding out why is by going to having a dental appointment with your dentist, who would look in your mouth and give you the treatment required if you need one. Or knowing that there is this disease, there's something that is wrong that is causing this. So I think I've made it clear. So I mean, that is the key. That's the key here to this podcast, like to this topic. The key of this, knowing about this halitosis and oral hygiene. Okay. So generally, there are treatments. What you're supposed to do as a human being to help you, at least the first aid to help you with this before knowing what to do next. Okay. One is mouth rinse and toothpaste. Like I said, brushing and flossing. Ensure that you brush regularly, at least twice a day, to help you with this. Then if you have a dental problem, if you know you have a dental problem, that's when you even need to take care, especially take care of your mouth. Do what your dentist has said to you, like do it, okay? And then it's also out, before I forget, to also let people know, it's good to visit your dentist for like a dental hygiene or checkup every 6 months. Yeah, it's actually good. At least visit every 6 months. Every 6 months is like twice in a year. Yeah, it's like twice in a year. So every 6 months, visit your dentist. At some point, I thought we've run 24 months in a year. So every 6 months, visit your dentist. It's like twice in a year, and have your teeth or your mouth looked at. Then floss at least once a day. Okay. So while you're brushing regularly, at least twice a day, remember to floss at least once a day. It helps to remove food particles and the plaques from your teeth, like in between your teeth. Yeah, your teeth. And then clean your dentures or your dental appliances. If you know you use dentures, you wear bridges, you wear braces, clean it as instructed. Okay. Then always hydrate your mouth, and as you're hydrating your mouth, you're hydrating yourself. Drink as much as you can, because research has it that dry mouth actually brings about mouth odor. Um, so you drink as much as you can, and I think there is also when you have like persistent dry mouth. I think there's a treatment for that, but this is something that you need to discuss with your doctor, as regards like to help you you know what to do about this. So I think there's a treatment for dry mouth. And regularly, this is very important, get a new toothbrush. A lot of us use a toothbrush for 1 year. Change your toothbrush. It says you should change it, I think it's every 3 to 4 months. So change your toothbrush. Try. It's something that we don't remember. At least 3 to 4 times in a month. And then, like I said earlier, have a regular like visit your dentist. We forget. The mouth is something we are quick to. It's easier for us to say, "Oh, I need to buy this face one. I need to buy this body wash. I need to buy this cream." But then we forget our mouth. We forget our teeth. We forget that communicating with people, it helps with your body image. You forget that you communicate with people, and then sometimes you leave this impression of, God, what is this? Because people are perceiving that thing that's coming out. Okay, so we forget it, but it's very important. As much as you're taking care of your body, you're taking care of everything, like your physical, your appearance. Don't forget your mouth. It's important. So, I'm going to say something regarding flossing or floss. Let me just show you something here. Now, this is a floss. I don't know if you can see it here. This is a floss. And this is also another one. Now, personally, I'll show you a difference. I know that sometimes it depends on what you like and what you prefer, but I think, like I said, that's personally, I think I'll just show you a difference, and the one for me that is best, and I think generally as well. So if you look at this two, this white one and then this pink one, this is tiny, it's very thin, yeah, but then this is not like it's very thick, but this is thicker. So I would recommend using this instead of this. Why? This is more balanced, and I feel like this one it doesn't really do the job well, and then it makes you like makes you, I think it would even, should I use the word, cause you like it could bruise you, like make you bleed more than when you use this. This does the job well, and it reduces that bleeding, because this is like sharp, when you use something that is sharp, because it's very thin, and then when you use something that is thicker and more balanced. And it's also important to know that when you have never flossed, like when you're starting to floss, when it's your first time, it's okay to bleed. When you see blood when you're flossing, don't panic. Like you will kind of hurt yourself, and then you're bleeding. Not like you'll be oozing, not like blood is pouring. No, it's okay to see kind of just little amounts of blood. But like I said, this is better. Yeah. So I decided to show you this as well. And when it comes to toothpaste, so many people use different toothpastes. Well, it's okay to use the one you're comfortable with, and it's okay to use whatever you're comfortable with. But then it's advisable. I think the Department of Health recommends that use a toothpaste that has fluoride. Yeah, use the one that has fluoride. But in addition to that, I'd like to talk about this particular toothpaste, Utimol. So let me just show you this. You have the Sensodyne toothpaste, okay, which a lot of people know it's for. You have this Utimol. People don't like it. Some people don't like it, but some people find it very useful as well. So this does not have fluoride. This toothpaste does not have fluoride. I'm not even showing you well. Okay, whatever. This toothpaste does not have fluoride, but it has like an antiseptic agent which helps with plaques and helps with bacteria. So, but Sensodyne, Sensodyne, it has fluoride. It has fluoride. It also has some antibacterial effects as well, agents as well. So, but it depends on which or what works for you. A lot of people have said that this one causes like sensitivity, makes their gum bleed. Or so if you want to use it and then you use it, I know a lot of people have said that it's okay, it's good for mouth odor, like if you've got breath or mouth odor halitosis, that this helps you with it because it has this strong, when something has antiseptic effect, you know what it means. So but people have complained about being sensitive to this toothpaste. So if you use it and you eventually react to it, then stop using it. I think focus on your Sensodyne, or you ring your doctor, visit your dentist who would give you the best to use. Then Colgate as well. Colgate toothpaste has this antibacterial effect as well. I think make Jolly, they all have it, but I think it depends on the should I say the amount. So, but the key to having a good oral hygiene is flossing. Like, key to having to prevent to keeping ensuring that your mouth is, not having mouth odor is flossing. Flossing your teeth, like flossing, and regular brushing, hydrating as well, and visiting your dentist. Okay. And so I'm going to drop a video. I'm going to show um to drop a link where you can watch how you can floss. There are different types of floss. You have the one that's like string, like a rope, I don't know how to do it, but it's something that's very easy to use or to learn. The video describes it. So you can watch the video and learn how to do it. I'm also going to drop a picture in case you don't know what a tonsil stone is. I'm going to drop a picture so that you'd see what a tonsil stone is. Maybe you've seen it, so that at least you know what this is. And yeah, so I wanted to say something else. I wanted to say something else. I'm going to share below as well this group that you can get. They sell medical equipment, they sell different things, whatever you need in a hospital. If you're a private practitioner, if you work whatever you need, whatever medical equipment you need, they sell it. They can deliver to your home. They're also on Instagram, but I think I need to find it. Let me know if I would find it here and then give you. Let me see. It's Draco Medicals on Instagram and on Facebook. I could also mention or spell out or read out the phone number for you in case you need to contact them. It's 09082320151. So they have different kinds of medical equipment. In case you need anything, just ring them, contact them on Instagram or Facebook, or you ring them. They're also on WhatsApp in case you need to get anything that you need. Yeah. So we've come to the end of this video, or this whatever. We've come to the end of it, and I appeal, just share, listen to the end, share with your friends, and then practice this. This is an awareness. I'm trying to create awareness because, like I said, like we know health is wealth. Imagine, it's not about, and I think knowledge is power. Sometimes you need to know. So this nursing and therapy, it's a medium where we talk about different things. My next video is coming up just very soon. We'll talk about different things, and then you can always ask your question. My email address will be down there, and on Instagram my name is Odour. On Facebook my name is Odour as well. And if you need to know more, you can ask your question. If there's something that you want to talk about, if there's anything you want to discuss, just send a message and then we'll talk about it. So we've come to the end of this topic for now. I know I'm going to see you again, And I urge you to please, 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 or I beg you to please, please, please subscribe and then share with your friends, like it as well, enjoy, and then ask your questions, and then every other thing. Take care, guys, and see you in my next video. Bye, bye, bye.